Welcome back to another episode of Time Out with the Sports Doctor podcast. And I want to start off by just thanking you for 200 episodes. It's kind of hard to believe that I've been doing this now for over 4 years, 4.25 years, 200 episodes. For many of you, you've been here since day one. For those who have joined along the ride, thank you for being here. For some of you, it might still be new. So Time Out with the Sports Doctor started Father's Day 2021 on 3 pillars to help you strengthen your mindset, to help you grow your assets, and to help you achieve whatever level of success you want to achieve in your life. And we've stuck with those 3 pillars as we continue to grow, as we continue to transform. The show doesn't look like what it used to in 2021, but we still stick to those 3 pillars. And also, I want to thank the people that have poured into this podcast, people who have been partners with me, people who have been guests on this show. Also for people who have made suggestions or given feedback to be able to tell me what type of content you want to hear. This has been really an evolution for me, looking back to where we started. I mean, my kids are in a whole different phase of life. My family, we're in a different place, different job, new house. So a lot has changed over the last 4.5 years, give or take. And you've been able to be a part of that, being able to watch me grow, being able to watch me transform, and hopefully at the same time, being able to learn information to help you do the same. You know, I don't know what's next. It's funny how this podcast works. I don't necessarily script out seasons. Some people do seasons. I have 200 episodes, all one season. But it's amazing to just watch God kind of orchestrate things and how his plan comes together through these episodes with the timing, even with the timing of how these episodes land sometimes. So on the last episode, we had Dr. Wilsa on. We talked about mental health for athletes. Today, I'm going to be sharing with you an episode that I recorded on Mississippi Public Broadcasting Radio with Dr. Mary McLeod on Southern Remedy Kids and Teens. So we talk about a lot of back to school. We talk about injury prevention and just healthy living for teens and adults. So hopefully this episode will be informative for you and continue to give me feedback, what you want to hear. I heard you say, hey, we want to hear more about money. So we brought back Money Mondays. We've also partnered with other companies to teach about disability insurance with Pattern Insurance, and then with Doc2Doc Lending, who we've been doing the Money Mondays with to provide educational information. So we are not stagnant. We're continuing to grow. We're continuing to evolve, and we're really doing that by your response, your feedback, and what you say will help you the most. So be blessed. Enjoy this episode.
Today, we have Dr. Derrick Burgess on with us. He is an orthopedic surgeon at UMC, and he is going to be talking to us today about some of the common orthopedic injuries that we see in our kids. And then we're also going to talk some about some of the orthopedic things that plague us as adults as well. So tell us a little bit about yourself, some of the training that you did, and some of the things that y'all do at UMC.
Sure. So my name is Derrick Burgess. As you said, I'm an orthopedic surgeon, but I specialize in sports medicine. So with my training after high school, going to college first and then medical school for 4 years. And then I did a orthopedic surgery residency, which is a 5-year program. And 1 year after that, doing a fellowship, which is where we really hone in on treating athletes and doing minimally invasive surgery or arthroscopic procedures that deal with the knee, shoulder, hip, with ligament reconstruction, also meniscal injuries, cartilage repair, things of that nature. So my practice overall, I deal with a lot of athletes, but the range and spectrum of athletes go from adolescents to our weekend warriors to actually, older patients now are being more active and staying active. So I treat a wide range of patients, but the sports medicine program, we have a large group of individuals. It's not just me as an orthopedic surgeon. We have primary care physicians, we have athletic trainers, we have physical therapists, and then we have a lot of consultants that we work with as well to help us take complete care of the athlete.
So one of the things that we were going to talk about as well is UMC actually has an after-hours clinic as football season, I think, most start next week.
So, we have Jamboree next week. And then for the public schools, the kickoff is on the 28th.
Okay.
That weekend.
Okay.
Yeah.
I think some other schools, start next week.
Probably so with the private schools.
The private schools, I think some start next week. So, it's here.
It's here.
So tell us a little bit about y'all's clinic.
Yeah. So we'll have Well, right now, 5 days a week, you can see a provider in sports medicine, which I think is excellent, which allows athletes to get in to be seen quicker. And I think having the quick diagnosis, early diagnosis is really key to having a successful return to play, especially if people want to be back as soon as possible. But during football season, we have extra clinics that are each Friday night from 9:30 to 11:30. We're there as walk-ins are welcome. Now, if you're affiliated with one of our schools, the athletic trainer is probably going to give us a heads up. But if not, walk-ins are welcome. You can come in, be evaluated. Diagnostic tests can be done at that point. Hopefully, we can come up with a diagnosis and start treatment as early as Friday night instead of waiting until Monday, Tuesday to figure out what's going on and then starting treatment.
Yeah. So y'all have like imaging and things there. And I would assume like bracing and things like that may be necessary. So
correct. Anything that you need. And walk-ins are welcome. Now, if we know ahead of time, you can call ahead of time. If you want to write down this number is 601-815-4721. You can call ahead and tell us that you're coming. But if not, we're going to be there from 9:30 to 11:30 from kickoff of the season through always until the playoffs. So we're there for every Friday night. There'll be a provider available. And like you mentioned, for the evaluation, for diagnostic testing, bracing, whatever you need.
Yeah. I think that's such an awesome thing to have. Because like you said, the earlier you can intervene, then the better the outcomes, the quicker you are to return to play. And so it can be really nice.
And you get to avoid the ER on a Friday night.
Yes, that is a very true statement. Yes. All right. Well, let's talk just a little bit about what are some of the common injuries that y'all do see this time of year. I know football obviously is the big sport this time of year in the fall. My little cousin plays girls high school soccer. It used to be in the fall, but they actually switched her to the spring, but some may still be playing soccer this fall.
Softball. So in the private schools, softball's going on.
Yeah.
Cross country is going on. So a lot of athletes are out.
Yeah.
People think about football because of the large number of athletes on the field at the time. And that football, because of the intensity of the sport, and it's a collision sport. So injuries happen. And being able to we have an athletic trainer at all the schools that we work with. They're at their practices. They're monitoring the athletes throughout the week. So they're able to develop a relationship not only with the athletes, but with the training staff and the coaching staff and the teachers. So everyone's looking out for the athlete. It's not just one physician or one trainer, because many times the injury is not noticed immediately. It might be the next morning when they come to school, or with head injuries, it might be that night when they get home. So it takes everyone to really care for the athlete.
Yeah. What are some of the common injuries that y'all see?
Yeah. So I would say most injuries that we see are minor. It's going to be bumps and sprains, right? So contusions, ankle sprains, knee pain. Some of it's chronic knee pain. We might have a new knee injury. And then we also see fractures. So especially with football, we can see fractures or dislocations, ligament tears and meniscal tears in the knee.
Yeah. I was a cheerleader growing up, and I can remember being on the sideline and watching like some of their shoulders pop out and they just pop it right back in and keep going. And I feel like in the concussions, I can think of multiple times they got concussions, but then would just go right back in because, that was...
It was a different day and age then.
It was. We didn't know any better, but I can remember that now. Yeah. So I think it's so good now that we have so many more resources now, I feel like, and people are so much more aware to be conscious of that too.
And you mentioned cheerleading. We definitely did not overlook our cheerleaders because
that is true.
They're training hard, and especially with some of the stunts that they're doing, they're putting themselves at risk just as much as the athletes that are actually on the playing field.
Oh, yeah, for sure. And the stunts and the flips and all the things So who would you say is injured more, girls or boys, or is it about the same? Or is there one specific thing? I feel like I always heard girls tore their knees up more than boys do. I don't know if that's true or not.
So when we mention ACL injuries, girls get injured about 4.5 times more frequent than guys do. Now, what sports with soccer and basketball are mostly for the female athletes, and then with boys, it's basketball and also football. But I think football, again, because of the number of people playing the sport.
Yeah.
Now, with ACL injuries, a lot of times it's a landing or cutting and pivoting, which we call a non-contact injury. So it's not necessarily from the collision. It could be when they're trying to change direction, or the cleat gets stuck in the ground, or when they're trying to rotate or twist.
Yeah. Yeah. So is that true? Girls tend to do that more than boys?
So it's for many different factors, from body habitus sometimes to alignment, to the way that landing mechanics and cutting mechanics, but it even is multifactorial, as we said. It's not just one thing, but there's a lot of research behind it now, so we understand it and we know how to train athletes differently, even before the injury. So preseason training and neuromuscular training is what it's called, how to properly land, how to change and cut positions. So when you're on that field in the moment when you have to make that decision of how to cut, not even making a decision, it's really reacting, you're able to safely do it.
Gotcha. So speaking of different factors, I feel like turf fields are big too now. So is there a difference between like turf and regular grass? We're talking about, I guess, mostly football, soccer, some too.
Yeah.
Is there a difference? Like, are you more injury prone for turf versus grass?
I think the research will say it's equivocal, but I think it depends on the turf. All turf is not created equal. First generation turf was almost like having concrete with green carpet on top, but the turf now gives a lot more. It's a lot more grainy than before. The studies don't really bear out that it's worse, but a lot of people will say that they see more injuries on turf fields for sure.
I feel like I've always heard that, but I'm definitely no orthopedic expert. And so what are some ways to help prevent it? So for people who are listening and maybe they have kids or grandkids and they need some tips, and what are some things that they can do to help just prevent common injuries like you were talking about, knees, and then I want to talk a little bit about overuse injuries too, because we see a lot of those as well. But what are just some general tips that you would give?
Yeah. So I'll start off with what we don't talk about a lot is rest and proper diet. So those are things that are very important that are many times completely overlooked, because many times our athletes are showing up to school, have not eaten, and then they don't like what's on the menu for lunch. And now here we are, it's at the end of the day and you're going to practice, or even on a game day, you might have a pregame meal. And I've had many people say, I didn't like it. It was too greasy. I didn't eat. I ate some chips, and here we are at halftime and you can barely hang on and you're throwing up, and now we have another half to play. So I think proper nutrition is important. Right now, dealing with this heat, proper hydration is important. So those are things that we definitely cannot overlook. Now, as far as the training of the athlete, we talk about proper warm-up. So now we know about dynamic stretching is more than just standing in one spot, touching your toes and then doing your arms in a circle and then getting ready to go play. But going through a real dynamic warm-up system set before you start your activity, as well as doing off-season training in weight room. Many times during the season, people completely forget about the weight room, but the strengthening is important as well as the proper stretching.
Yeah. And I hate stretching.
Right. It's just show up late and get started. So,
I know. But stretching, it's not just for athletes too.
Correct.
I mean, I feel like especially there's been so much of a push of like weight training, I feel like, as you get older, so maybe some of our women listening are trying to do that now. And I mean, you have to stretch or you could hurt yourself. Even when you're doing just something, just some light weights, not even heavy weights, you still have to make sure you're stretching really good.
Yeah,
too.
proper warm-up is important.
Yeah, and it's no fun, but I know it's important. Okay, so let's talk about overuse injuries, because I feel like that is another big topic. I immediately think about baseball.
I think everybody goes immediately to baseball.
Because kids play baseball all year now, I think like 10 months out of the year, as opposed to like when we were growing up, it was just summertime baseball.
Every season had its own sport. I mean, every sport had its own season. Now, many sports you can play year-round, like you mentioned.
Yeah, so baseball, everybody hears about like the Tommy John surgery and all of that. So what are some of the more common overuse injuries besides just arm and baseball?
Yeah, so you mentioned baseball, shoulder, elbow. Tommy John surgery is, people know a lot about it because it's been talked about, especially in Major League Sports, because you're out typically 12 to 18 months. So it has a large financial part of it. So I think it gets a lot of press. But also we see a lot of soccer athletes, basketball athletes playing the same sport. And I think of what happens when you're playing the same sport is that you use the same muscle groups over and over. So that's why that cross training is so important. And that's why proper stretching is so important, because you're using the same muscles over and over again. With basketball, we see a lot of knee injuries. We see ankle rolls or ankle sprains, but I say knee injuries are probably the most frequent thing that we see that have the longest term implications. When you tear your ACL or you tear your meniscus, these are injuries that you don't necessarily just completely heal from. They can continue to hamper you as you move forward in your career or as you become an adult. And I think many times we focus so much on getting the athlete back to the court or back to the field, and we're not really thinking long-term about what does the health of this athlete look like 10, 20 years down the road.
Right. Because if you have an old injury, you're more likely to have arthritis and things like that in your future. And so you do have to think about all of that.
It made me laugh because patients come in and say in 2000 or 1990, I injured this knee and, it still bothers me. So, and unfortunately, sometimes you do heal and you get back to regular play, but many times that injury can bring up, further implications later.
Right. So we have been talking a little bit about like preventing injuries, and we talked about stretching and some of the dynamic stretching and cross training. We mentioned that too, how important that is, and not to be so focused on one sport. And so a couple of other things that I kind of wanted to piggyback off of is I feel like a lot of people get braces or they get like straps and different things to put on their body. And
Kinesio tape.
I was about to say KT tape, all of those kind of things. Now, is there any benefit to that? Like, what would you say? Would you recommend that or no?
I do think that I would give braces or prescribe braces frequently, but braces work, but they work when you have the correct diagnosis. And many times people will come in, they've already bought a brace, and then I make the diagnosis and say, well, you need a brace, but it's not that one. So I think if you know exactly what's going on, and a brace many times will provide stability or even just some kind of reassurance for the athlete or for the patient to feel better, or compression to keep down the swelling. So it gives them feedback on their joint kind of proprioception, which makes them feel more stable. So braces can work, but I think you need to know the right diagnosis first. And many times you'll come in, I'm starting to examine the knee and they're peeling off multiple layers of braces. So that's always funny to see.
Are you a young physician who's frustrated in figuring out how you're going to continue to fund yourself through this early phase of your career? Are you tired of speaking to lenders who do not understand your plight? We have a solution for you. Let me introduce you to Doc2Doc Lending.
Hey everyone, I'm Dr. Zawadi Marshall, co-founder, CEO of Doc2Doc Lending. We are the exclusive lending partner for physicians and dentists in the United States. We underwrite our loans thoughtfully, knowing the physician journey and your career trajectory. We're a company that's been founded by doctors and built for doctors because we get it. Banks don't understand all the ways in which we struggle through educational debt, consumer debt, as we're trying to make ends meet during a very challenging time of our lives. Doc2Doc is underwritten with thoughtful process that's meant to give you credit for all the unique physician characteristics that you have, like being board certified, having a dual degree, undergoing and finishing a specialty or a fellowship as well, and just being employed as a physician. All of those things give you credit to get your interest rate lower with our platform.
So we are glad to partner with Doc2Doc Lending. So if you are stuck trying to figure out where you can get funding or where you can continue to support your family during this time of transition in your career, we offer you a solution. Doc2Doc Lending, physician owned, understands your plight, understands what it's like to be an early physician or a physician who wants to do something outside of medicine. Check out Doc2Doc Lending.
This segment is a paid advertisement for Doc2Doc Lending, Inc. Loans are made available by DR Bank, member FDIC, and are subject to credit approval and available in approved states only. Representative APRs for Doc2Doc range from 9.99% to 26.99%. Terms and conditions available at Doc2DocLending.com.
I think I had some like patellar tendonitis, so I bought one of those like straps. I don't really think it did anything, but I was like just trying anything because I was doing training for a race.
Yeah.
But yeah, sometimes I feel like they can't be helpful. But
yeah, they can.
Is there any benefit to the KT tape?
So KT tape is helpful, but once again, you have to know how to properly apply it.
Yeah.
And what forces are you trying to combat when you put on the tape? So not just slapping the tape on your leg is going to help. You have to know what you're trying to deform or what you're trying to compress by putting the tape on.
My favorite is what I used to run a lot more than I do now. But you go to those races and people would just have them all.
The brighter the colors, the better they work.
I know. And I always was thinking to myself, I wonder if there's any benefit to this. Yeah. Okay. And then one other question I wanted to ask is, and I don't know, you may not have a real opinion about this, but some people will say they recommend kids playing multiple different sports and not kind of focusing on one sport until a certain age. Would you have a recommendation on Like when you could like, okay, you really see some potential for this kid in baseball. Like when could they really move to baseball versus like, oh, I see some potential for basketball. Let's quit playing these other sports. You know what I mean?
Yeah, I'm
Does
with
that
you.
make sense?
Yeah.
When would you say is a good age to kind of transition your kid to be able to focus more on one sport?
So I would say that's a very gray area, but typically as an athlete starts to show that I'm going to do well in this sport, but I would say no earlier than late middle school to early high school. So because at that point, the body has developed and the growth plates or physes for many people are starting to close. So they can take a lot more impact than before. But 13 to 15, you'll see different things or when you should specialize, but not for your 6-year-old who's playing baseball on 3 teams. And what really happens is what's dangerous is when they're playing on multiple teams at the same time, especially your son, he's an ace pitcher, so he's closing for every team that he plays on, and then he's playing on another team, and he's playing catcher. Those things add up really quickly.
I have a question. This is Liz in the control booth. What about swimming? What if they're a competitive swimmer? When, is that a year-round sport, or is that one that should also be seasonal?
So I think swimming, what I see with most swimmers is that they swim 4, 5, 6 days a week. And swimming many times is their only sport. Now, I have seen swimmers who have weightlifting, I think, is really important with swimmers as well as conditioning outside of the water. Now, I do tell my athletes many times swimming is a good sport for you to do for your cardiac workout, as well as it helps you get a full body workout. And that's for the adults that have arthritis. Water aerobics and getting in the pool is important. So I've had several different families that, someone wants to be in the pool, somebody does not want to be in the pool, but I do feel that the pool is a good place. Now, with swimmers, we do see some repetitive injuries in them as well because they're using their shoulders so much that they really should have some cross training as well.
Yeah. Yeah. I know when you watch the Olympics and they do those stretches and they can like flap their arms back them out.
And swimmers look a lot different from what they used to now. The guys are very muscular. The ladies have, everyone's working out now, no matter what your sport is. So just practicing your sport is probably not enough at this point.
Yeah. And swimming is a wonderful cardio.
Yeah.
I raced my little cousin in the swimming pool this summer and I about died. I came up it's just a whole different type of cardio, I feel like. But yeah, I tell a lot of people, patients who especially have knee problems, just bad arthritis in their knees, you're essentially weightless in the pool. So it takes a lot of stress off of you. And so it's a good way to still get your heart rate up and you still still have some resistance, but not nearly as much as you would.
One thing I wanted to add about the single sport specialization is athleticism. So we have highly trained athletes that can play a sport, but what many times recruiters or professional teams are looking for is a good athlete.
Right.
And you develop that athleticism by doing many different things, by going out playing on the playground, which is kind of a lost art, but playing different sports, coaches like that because you get different perspectives of life, and from a sport and training aspect.
You hear in interviews, you know what I mean? They'll say like they didn't pick up this sport until middle school, high school, something like that. They haven't been always training for this.
Correct.
I just feel like society puts so much pressure now, especially with all the travel ball and the travel soccer and the travel discs and AAU and all the things that you feel pressure that if your kid's not in this, I don't have a great answer for it. I'm not telling you don't do travel ball. I'm just saying I can see how it is hard for parents to have to make that decision to tell their kid, no, you can't play this 10 months out of the year,
Now, if you want your phone to ring, say, do not play travel ball.
Yeah. Yeah, I'm not saying that because it is a difficult thing. I mean, So another thing I want to talk about, another very common injury, and this is not just sports injuries. Like I was just telling him at the break, I had an ankle sprain at a concert. I was trying to run to the bathroom really quick to get back for the songs and stepped down wrong on the stair. And that sprain hurt so bad for a good 2 weeks, but it took probably almost 6 weeks for it to go away because it hurt so bad. So I said, I never say it's just a sprain anymore because a sprain can be so painful. It can cause a lot of swelling. It can cause a lot of discomfort. And you can get it. Our kids get it playing basketball, playing on the playground. Adults can get it walking down the streets of Jack and then tripping a pothole, I mean, like you can get a sprain very easily. So tell us a little bit about what a sprain is and how we can rehab that. When do we need to go to the doctor?
Right. So a sprain is an injury to a ligament without completely tearing it. So you have different grades of sprains leading to a tear, where a strain is a muscle injury. But with an injury to a spraining a ankle, for instance, you injure not only the muscle and tendons and around the ankle, but you can also have an injury to the inside of the ankle joint. You can damage cartilage when you have a sprain. So if you've gone through the RICE therapy, rest, ice compression, elevation, and you're not improving in 5 to 7 days or so, you probably should get evaluated. Or if you think you sprained your ankle and you cannot put weight on it, you might need an x-ray because it could be fractured at the same time. But some sprains need surgery, just like some fractures need surgery. So you cannot just say it's a sprain and brush it off. Many times what we see is recurrent sprains because they're not properly rehabbed. So an ankle sprain, I tell my athletes all the time, if you just limp through it and wear a brace and do not rehab, you're probably going to sprain it again. Versus if we take the time to really strengthen this ankle again, make sure the swelling and edema is out, and then return to sport, you're more likely to be able to continue the rest of your season without having hampering injuries throughout.
How long would you say on average is somebody out for just a mild, moderate sprain?
So I would say mild to moderate, 1 to 2 weeks. But if it's severe, it could be 6 to 8 weeks, which is about the equivalent of many fractures.
Yeah. Nothing is worse than when I have like a senior in high school come into clinic and I'm like, you've got a sprain, but you really are going to have to sit out, at least a week.
And truthfully, sometimes a fracture, you can play with it with a cast and you pad it versus a sprain, a bad sprain, you're out, until it's better.
So say you have somebody out there listening who has been prone to sprains, who has sprained their ankle a few times. Are there braces or support devices that you would recommend for somebody that has that?
So if you have an ankle sprain, yes, wear an ankle brace. However, the most important way to brace is by strengthening that joint. So seeking proper physical therapy or even going online to do some exercises prior to presenting to your physician, all of that will help in the long run.
What about shoes? Are there any certain shoe recommendations you would say, like when somebody's picking out basketball shoes or tennis shoes?
I think the reflex would be to say, hey, wear high tops. But many athletes some people don't like wearing high top shoes. Some people wear mids. Some people wear lows. But I think at the same time, strengthening that joint is important. And then if you know that you're hampered or have had predilection to having sprains, maybe wearing a brace along with it, or even sometimes if you have an athletic trainer with you, taping that joint will work. But that's not going to work for long term. It's going to loosen up.
Right. Yeah. All right.
And please take the tape off before you go home.
Yeah. Last thing we'll talk about, just kind of keeping it with the sports medicine, is concussions. And again, we go to football, but I know soccer and basketball.
Baseball even.
Yeah.
Collisions in the outfield or getting hit by a ball.
Yeah, I guess. Yeah. So tell us a little bit about concussions, because like we were talking about at the beginning of the show, we've come so far with concussions. We used to just throw you right back in the game, but now we know some things to look out for. So what are some things that parents, grandparents listening can look out for their kids to see about concussion?
Right. So that concussion is a sudden injury to the brain that usually leads to change of consciousness sometimes when it's really severe, but just mood changes. It could be just a headache or sleeping disorder where you cannot fall asleep or you're sleeping really long. So you have to really have your antennas up really to make that diagnosis unless you see it. On a football field, many times it's a violent collision and you're looking for it, but it could be the way the kid fell and hit his head on the ground versus hitting another player. Also, I don't want to overlook, like you mentioned, you trip and fall down the stairs, you can injure that ankle, but if you hit your head, that could be another cause of concussions. And many times we see it in a traumatic injury or the trauma situation where you're in a car wreck and you're treated for all the musculoskeletal injuries. And then I'll see you and you say, I've been having headaches. The lights have been bothering me. I have not been able to sleep. This has been going on for a couple of weeks. So many times when you're going to the ER to be treated for the traumatic injury and you don't have the follow-up, the concussion can be missed. So from an athlete standpoint, the trainers, the coaches, the other players, everybody's important to help make that diagnosis.
Yeah. Well, because there's no good way to diagnose a concussion. Like, I
Correct.
can't just take a picture of your brain and say, you have a concussion.
Yes.
And there's no specific test. It's more of what we would consider a clinical diagnosis. So examining you, taking a good history. And so you're right. It's so important to make sure that I think the biggest thing is just being more aware of it, that it could be a thing. So yeah, like I said, we've had so much more awareness about it, but still probably not enough.
Correct.
And it's another thing that it's one of those things like a sprain, like we were talking about. It takes time to heal.
And it takes longer than you would imagine because many times when you look at the kid, in the very beginning, eyes might be unable to focus or, being bothered by lights or loud noises. But over a period of time, you're going to get to the point where you look normal. However, it takes the brain longer to recover. So on average, I'd say 2 to 3 weeks. But if very rarely do you have someone who's injured and they're ready to play that next week.
Right.
But sometimes it will happen, but it's usually a couple of weeks to be able to recover. And it depends on sometimes other comorbidities that you have that can make it worse as well.
Yeah. And one of the things that we do, and you can elaborate on this a little bit more, because I don't do a ton of concussions, but we do a stepwise approach going back to it. So when you are recovering from a concussion, you can't go all in.
Correct.
Because then that's just going to kind of set you back typically. So we kind of have to slowly work your way up or kind of graded exercise to get you back to goal.
Yeah, we start off with a period of rest and then slow progression. We have Dr. Rudy Napadano, who does a lot of our concussion work in the sports medicine department. So if you have an athlete or someone who's been suffering with headaches or different things after an injury, you need to have them evaluated.
Right. Hey, Wyatt, are you there?
Hey, good afternoon.
Yeah, what's going on?
Our son, about 2 weeks ago, had a playground injury, broke his wrist and required surgical placement of pins and then casting for healing, and is set to get the cast off and the pins out in about 3 weeks. The interim visit with x-rays indicated that healing was progressing as anticipated, which is good news. He is 8 and active, and we are trying our best to keep him from acting cool with a cast on. He's been generally cooperative, but I know once, especially as our weather hopefully cools a bit, he is raring to go. So they said, for a couple of weeks after the cast is off and the pins are out, we've sort of been given we'll have them take it easy. And I just wanted to see if you could sort of operationalize that a little bit more. We want to be able to, have them open up to physical activity that has been more limited because we, fear interrupting the healing. So we want to be careful, but at the same time, we want them to try to have a return to normalcy as quickly as we can.
Yeah, so one thing, I don't know his particular injury. However, I'm glad to hear that he is progressing. But kids are very resilient and they heal pretty quickly. So when I tell a patient to take it easy, I'm usually trying to say, please avoid further injury. So don't do risky things that are going to, however he injured himself the first time, put him in that situation. So you want to try to avoid falls. You want to try to avoid things that put a lot of pressure on that bone that's trying to heal. However, it's going to be really specialized towards what injury he's being treated for. But we do know that what we tell a kid and what happens is going to be two usually totally different things.
Yeah, I have a friend whose kid broke her collarbone, healed it up after about 4 to 6 weeks, literally 2 months later, exact same injury, break it again in a different place. So yeah, trying not to put them in the situation. But at an 8-year-old kid, you don't want to tell them they can't do anything, but just trying to teach them to be more cautious. And it's hard to do though.
Thank you for continuing to support this podcast. If you enjoyed this episode, then please leave a 5-star review. And if you haven't done so, subscribe so you continue to get the updated episode. Until later, peace.
With the sports doc. Keep our head right in the game. We ain't never stopping. You are now tuned in. Trust you don't want to miss. This is where life, sports, and medicine.